The crisis of drugs in jail. To discuss, we're joined by Nichole Manna, investigative reporter at the Tributary, an online nonprofit newsroom here in Jacksonville. Welcome, Nichole.
Hi, thank you for having me.
Mark Baughman, former law enforcement officer with 35 years of experience, including work as a special agent with both the NCIC and the DEA. Welcome, Mark.
Thank you.
And Ken Jefferson, 24-year veteran of the Jacksonville Sheriff's Office and longtime community crime and safety analyst. Welcome, Ken.
Good morning. Thank you.
So, Nichole, on Tuesday, the Jacksonville Sheriff's Office announced the arrest of a corrections officer and 16 others on charges related to drug dealing at the Duval County Jail. Bring us up to speed on that investigation and those arrests.
Right, so that investigation started in October after JSO got a tip that a correctional officer named Kobe Collette was somehow bringing drugs into the jail. Collette was immediately suspended. The investigation went on for 6 months, and he, along with his sister and a CityWorks employee, Corey Copeland, and 14 inmates were all charged with various drug charges. Corey Copeland is accused of giving inmates who are on his work service drugs. Kobe Collette was accused of actually bringing the drugs into the jail. And the sheriff said that he cannot indefinitely connect all of the charges together. A lot of these were brought up just in the investigation of Kobe Collette.
And so Kobe was removed from his job at the jail almost immediately back in October.
Correct.
But this investigation's been ongoing since then?
Yes.
Yeah. And so you've been reporting on the problem of drugs in jail for a number of months now. There have been deaths that have been linked to fentanyl in your reporting. And then just last week, we had at least three that we know of, overdoses on the women's floor at the jail. So give us an idea of what your reporting has found.
Yeah, so since 2022, 6 people have died of fentanyl overdoses with fentanyl in their system while they were in the jail. And most of those people had been in the jail for a couple of weeks to 4 or 5 months, which in some of the investigative reports I read, led investigators to believe that the drug was obtained within the jail. I think there were 2 people who died within a day or 2 of their arrest. I don't have half of the incident reports because there was an ongoing investigation. So I'm still waiting to see what those will tell us. And then you're right, in April of last month, on the 22nd, 3 women were found in this unresponsive state with discolored skin, all within the same housing unit. At least 2 of them were given multiple doses of Narcan, which is a medicine that will reverse the effects of an opioid overdose. And then they immediately came to and became responsive. All 3 of them were taken to the hospital for treatment. All 3 of them survived, and all 3 of them are back in the jail.
Mark, you worked for years with the DEA. How big of a problem is drugs, the presence of drugs in jail?
It's pretty big. I mean, obviously, over the years, contraband somehow finds its way in there. Typically, it's going to get in through somebody who's working there, a correctional officer, maybe even, you have a lot of trustees, and the trustees have more liberties within that jail. So a lot of times you'll see they're the ones that actually bring the contraband in. In this case, you had Kobe Collette, who was a correctional officer, more like a leader and organizer role, recruiting other inmates probably to distribute it once he could successfully get it in with his sister inside the system. So it's not unusual.
How has it changed, this problem of drugs in the jail, in the years that you've been observing and working in law enforcement?
Well, fentanyl's a game changer. It's a game changer in our society. You see it everywhere. I happen to do consulting work for Partnership for Safe Medicines. You'll see it's been laced in just about every drug out there that's being sold on the street, not through pharmaceuticals, but actually sold, being represented in Xanaxes, Adderall, Ritalin, you name it. It's finding its way in. Plus, the substance itself, it can be put in a liquid form, easily transferred to paper in this case, and brought in. Similar to LSD back in the 60s and the 70s, that used to be placed under stamps. It was a liquid form that was put on paper. Same thing with unfortunately fentanyl. It's will kill you. LSD, not necessarily people overdose, they do, but they don't. It's more of a hallucinogenic type drug.
Ken, what do you know about how JSO is handling the drug situation in the jail?
Well, a lot of things that they have to maintain privacy with it because you don't want the bad guy to figure out a way around it. So that question was posed during Sheriff Waters' press conference earlier this week as to, okay, what measures are you taking? And he couldn't share them. They really thought that he was kind of skirting around it, but he has to maintain that integrity of those investigations. And I'll expand on what Mark said. Um, um, as far as drugs getting into jail, he named the various ways, through family members or visitors, corrections officers. I'll even expand it and say sometimes rogue attorneys will bring in things and smuggle those things in as well because they got an outside contact. So drugs in the jail in correctional facilities are not anything new. It's nothing new. There's any jail USA, you're going to find drugs.
Yeah, and so there have been recent arrests, very recent, Ken, in Arizona, in Texas, in Delaware. Are individual facilities like, the JSO jail just left up to solve these problems that are obviously happening on a wider scale? Are they just left to solve them on their own?
Pretty much, because the sheriff is here in Duval County. The sheriff is in charge of the jail, so he bears that responsibility of security for those things coming and going, people coming and going. You have all kind of people coming and going with the deliveries. You've got to have linens, you've got to have food, you've got to have medical supplies, all these things. And these people are vetted very well, but you see the drugs still get in there. So when you get corrections officers, when you have a shortage, like JSO has a shortage of corrections officers, sometimes they have to scrape the bottom of the barrel just to fill those positions. They don't try to do it. My experience as a recruiter for JSO, it's not that you try to do it, but you have limited resources to get the best and the brightest. And sometimes these people have ill intent coming in. So you never know. And you can't read that on a person when you're interviewing them or trying to fully vet them.
If you're just joining us, we're talking about the problem of drugs in jail and prison. If you or a family member have been incarcerated, if you have a story to share, we invite you to join the conversation on social media. You can also email firstcoastconnect@wjct.org, or you can call us at 904-549-2937. Nichole, Ken Jefferson just alluded to the problem of recruitment, and certainly it's a very difficult job to be a correctional officer. Wages aren't great. Does that make them uniquely vulnerable to perhaps being involved in something like this?
I think it could. I think that is a great question to ask because I know that JSO, as well as other police agencies that I have covered in Texas and Nebraska, all had a really hard time with hiring, and not only hiring but maintaining employees at their jails. I've talked to correctional officers who've said it's not a fun place to work. It's really dark inside. You're inside most of the day. You're dealing with people who, don't really want to deal with you. So it's not an easy place to work. And here in Jacksonville, our correctional officers make less than our police officers right off the bat. I know that JSO has done some things to try to recruit. I think there was a $10,000 bonus at some point. JSO did a webinar a couple weeks ago for people who might be interested, and I actually joined that webinar. And I think it was me and maybe 7 other people who I'm assuming were interested in the job, and that's just 7 people.
Mark, the issue of recruitment is, it's a problem on a lot of levels. Law enforcement's facing a lot of challenges right now, a lot of pressures. And I heard something that I thought was really interesting actually this morning on NPR that sounds counterintuitive, but they were talking about how fewer officers can actually create its own safety issue because in some circumstances they might be likelier to use too much force because they're outmatched, they're outmanned, and that having too few, employees in a prison facility might create conflict beyond what would ordinarily exist.
Well, that's true. I mean, so if you have a facility like Duval County Jail, which the interaction between inmates and the correctional officer gets less and less. You have that central pod that's in there controlling electronic doors. The only reason, and you have general population, we have a bunch of inmates that are housed collectively together. So the interaction there, you're going to have a correctional officer that may be called down, physically called down, summoned down to break up a fight, investigate something. Someone's passed out on the ground or on the floor. Now you may be the only officer down there, so you have to use a lot of diplomacy. Plus, they're not armed. I mean, they're down there. They're limited on what they can do. They have to if they have to physically combat somebody, they're going to bring other officers with them, but that may take a little bit of time. So it does create a problem for the correctional officer. And can I add something is that, when I first looked at JSO back in the 70s, it was and Ken can probably attest to this, that you had to work in the jail 2 years probably before you got out on the road. Am I correct, Ken, with that?
That's correct.
And also, and maybe sometimes longer. I also heard from my sources that a lot, patrol officers are now being pulled off the street with less than a year on and being rotating in the jail. Like doing a week stint in the jail every month. So there points to the lack of staffing, manpower, whatever. And again, these bonuses that are offered, those are trying to get people in. And then Ken's been in recruiting. You have to vet these people. You don't want people that are acting like the people on the other side of the bars and they're working. So there's a lot to all that. The dynamics are all there right now for a situation where you have these overdoses, you have investigations in the jail constantly, and it's the sheriff's biggest liability is the jail.
You talk about them maybe not have enough defenses. What are they armed with, Ken? What do they carry with them? Are they not allowed to have a weapon?
They cannot have a weapon inside a jail or correctional facility for obvious reasons. They can be overpowered and unarmed very easily by a number of inmates. What maintains the integrity of the jails is the authority that the correctional officers have, the command presence that they have. They don't have a weapon. They have pepper spray maybe, and maybe one other type of chemical device that they can use to try to protect themselves. But as Mark said, these guys, the Duval County Jail holds about 3,000 inmates. Can you imagine if, let's say, 1,500 of them decide we don't want to be here anymore? They already outnumber the 600 correctional officers that's there, but then that's not 600 there all day, every day. So the integrity of maintaining decorum at the jail lies within those corrections officers. They're not paid very much, comparatively speaking, statewide as well as citywide here. They don't get recognized a lot. They don't get any pats on the back. So they go to work and they do what they have to do to support their families and to try to either go on the police side or do something else. But when you're talking about a $10,000 bonus that shows you that, hey, we need people, we got to draw you some kind of way, we're going to give you a $10,000 bonus to work here. Inmates are very manipulative. Let me just throw that out. They're very manipulative, and they'll find a vulnerable correctional officer and make that person go rogue, just like they did with the one that was arrested back in October, because they'll prey on that vulnerability. They'll look at somebody and say, that person's green. They don't know the streets. They don't know the street vibe. They don't know the street language. So we're going to manipulate them and lure them into our web, and we're going to get him or her to do whatever we want them to do, and that happens.
I want to ask you, because I know you were interviewed back in 2020 after a prison in southern Georgia where state prison had a riot. Basically what you're describing in terms of inmates overpowering the guards. They actually took a couple of guards hostage. Couple had to be hospitalized. They were beaten and stabbed. And there was basically 500 inmates roaming free, all of it being simulcast or broadcast on social media in real time. People were watching this happen. And after that incident, it sounded like some people just couldn't return to work. They were so traumatized.
Oh, yeah, it's a very traumatic experience. You got a very good memory to remember that from 2020. It's very traumatic. It's much like the effect that the incident that happened in Charlotte a couple of days ago, the impact that it has on those officers. It's difficult. It's very difficult. You go back to work with a lot of rage, a lot of anger, some regret that you're in this type of field of work. All kind of things are going on in your mind. But you have to remember the mission. You have to remember what you're there for. You have to remember your calling, because this law enforcement, either on the corrections side or police side, is not something that you just wake up one day and say, you know what, I think I'm going to be a corrections officer or a police officer. A lot of times they're there to either use it as a stepping stone to get to become a police officer, or they just need a job. And then once they get there, they find out that it's not paying a whole lot. If they're that gullible or vulnerable type, they can be succumb to those inmates manipulating them. So when you're vetting them, you can't go inside them and read their hearts. You can't go inside them and read their minds. You have to go on information that they give you and information that you uncover, and then go forward from there. And sometimes you pick the wrong one.
Well, we're talking about the problem of drugs in jail. If you want to join our conversation, you can give us a call at 904-549-2937. You can also email firstcoastconnect@wjct.org or reach out on social media. Nichole, you've done extensive reporting on the jail. Are there challenges facing this facility that are unique beyond what we're talking about in terms of national problems, national trends?
Probably not. I think most of my reporting into the jail has been about medical neglect and issues with the privatized healthcare and Armor Correctional Health Services that used to do medical care. But I'm seeing stories out of almost every other state that has private medical care that the same issues are there. So I imagine that the majority of issues are things that we could see nationwide. I just think it's up to our local leaders to decide how to handle that moving forward.
We have a message or two here from Facebook. Tom says, I didn't think they were allowing in-person visitation at the Jacksonville jail, something that is echoed also by David. And I want to talk about that because I know that there have been, I throw this open to all of you, but there have been attempts to rein in contact visits, certainly for the general public. Those have been reined in. But they recently tried to pull back on access for, investigators, attorneys, and attempted to do no contact visits. They got a lot of pushback from people who have to interact with those inmates, have to show them documents, have to go through their case with them, have to review files. Very hard to do when you're on a, phone and holding up something to a, plexiglass window. But that's not necessarily solving the problem, is it, Mark?
No. First of all, if it's an investigator that comes in there, he or she can sign that inmate out. They can take the inmate out for investigation. They don't have to stay inside the facility. Once they sign them out, they take ownership of that inmate until they bring them back. And again, this is a heavy burden for the jail because they got to search the individual again. They got to go through the process again. They got to sign them back in. A lot of inmates don't like being signed out. If they know they're being signed out, then the other inmates inside know they're cooperating. That could be problematic. Okay, so therein lies a lot of the problem. They'll say they're being signed out for a myriad of reasons, but ultimately sometimes they're being signed out because they're cooperating. As far as the attorneys go, they're very limited on what they can bring in. They cannot bring any electronic devices in. I believe at one point, and this may have changed since I've been in that jail, is that they could only bring maybe a pad or some type of writing device, but it couldn't even be a pen. It may have to be a pencil. They would have a room where they could meet and talk. That may have changed, that one-on-one. Most of these interactions that you're going to see with loved ones, with the inmates, it's going to be through some form of glass, picking up the phone, the other individual the inmate picking up the phone, and the communication is back and forth that way. Yeah, I think they've limited that one-on-one contact. I don't even know if they even have it anymore. Ken may be able to speak to that more so than me.
Well, you hit an interesting point, and that's not going to solve it. That's not going to solve the problem of the drugs getting in, because you're going to still have correctional officers, unfortunately, that will go rogue and try to make extra money, or for whatever reason that they do that. You can put all these systems into place, which they are nationwide for the most part, but we still find drugs in the jail. We're still seeing people overdosing in the jail as a result of it. I mean, you got several things that goes on in the jail that they're incarcerated. They've got plenty of time to scheme and to think about things. You've got sex going on in the jail. You got contraband being introduced in the jail, drug paraphernalia in addition to the drugs. You got money transactions going on. You got homemade shanks. that's being made during their time in prison, not just being made, but being used, against each other. So you got all kind of things going on other than rehabilitation and incarceration. That's that's way down there on the list. All these other things are going on way before rehabilitation. That's why when you look at your recidivism rate, they want to go back because they become institutionalized. They can't exist on the outside, so they end up going right back to where they spent a few years prior.
I think people are surprised sometimes to realize just how much contraband circulates in the jail. I know that when I was working over at the TV station, we would routinely get phone calls from people who were behind bars, on their cell phone. But I want to ask you about that idea of an officer being recruited, because there's also been a lot of reporting about the issue of something called like a sleeper agent, which is somebody that's either recruited on the outside or assigned on the outside with a clean record to apply for a job and basically, become an inside agent on behalf of a criminal enterprise on the outside, on behalf of a gang of some kind. Is that something that you've heard about?
I've heard about it on television. I haven't heard about it here locally. That's a very dangerous proposition as well. I've seen it in, I say movies or documentaries, but I've not really seen it here in Jacksonville.
There's been situations with my predecessor agency with DEA where agents have been hired, gone through the process, gone through the academy, end up being assigned to certain areas of the United States, primarily in South America ultimately, but they were initially somehow associated or affiliated with cartels. They were eventually, but they were solely brought in by, or pushed by the cartels into these agencies to infiltrate DEA so they can get into our databases, they could get corrupt information, they could control, they could find things out. I know that's happened. We've seen that. That's hit national news. We had this most recent arrest of one of the police officers who had gang affiliations, I believe, before he even got hired on with JSO, and he maintained those relationships with those individuals that were still in the gang, and it was ultimately funneling information to them as well. So that is on a very much of a local level. It happens. I mean, that jail is a wealth of information for law enforcement because all the calls are recorded. You have people cooperating, but at the same time, again, I'll say this, it's the biggest liability the sheriff assumes. There's sheriffs throughout this state, a few sheriff's offices, and throughout the United States, where jails have been privatized now, and they've given away, the sheriff doesn't want anything to do with the jail, and then they become privatized. That can be problematic, too, because they can be run in any manner. Most of the time, the inmate suffers greatly with these privatized facilities.
Yeah, Nichole, I know that your reporting has been on the privatization component of the medical care at the jail. And we should note that you just recently won a really prestigious award for that reporting. The National Institute for Healthcare Management Foundation issues awards, and you won the investigative and general reporting category. It included finalists from the Washington Post, the Tampa Bay Times, the Wall Street Journal, New York Times. So congratulations on that.
Thank you.
Yeah, it's good, important reporting. The question of addiction and drug dependency is a big part of the conversation because, research has shown that some 65% of prisoners, inmates, are either addicted, dependent, or in jail or prison because of a drug-related offense. And it's, I guess, indicative of why this is such a problem, drug use in jail.
Yes, and it's so dangerous for somebody who is addicted to any substance to go through withdrawal in a jail, especially if the medical care is lacking in any sense of the way. We have had deaths in the Duval County Jail because of people who were going through overdose. I've written about one of them, Lena Odom, and she kept going. And this was when Armour was in the jail, and she kept alerting nurses that she wasn't feeling well. And she was kind of just sent back to Gen Pop, essentially. And she later died, and it was tied to the fact that she was going through an overdose and that it was mismanaged. So it's incredibly dangerous to have folks in there who are actively coming down and withdrawing from whatever substance they're on.
She died because of withdrawal.
Of a withdrawal. Sorry. I
Yeah.
realized after I said that and then just kept talking for some reason. But yes, withdrawal.
Gotcha. We've got a message from Tom on Facebook. He says, keeping people in jail for an extended time creates a marketplace. Quicker turnover of inmates through limiting the use of cash bail, using civil citations to not put minor offenders in jail would drastically shrink that marketplace and reduce the profitability of smuggling. What do you think about that, Ken?
That's a legislative issue, that has to be supported by our local government and as well as our state government to be able to do all of those things. Those are good ideas. Is it practical? Don't know. It hadn't been tried. It hadn't been proven yet. Your citations, it's a great idea for nonviolent offenders to keep them out of jail. They're similar to misdemeanor citations. You just get basically a ticket, if you will, and report to court and pay a fine, and typically it's done and over with for those nonviolent offenders.
I mean, law enforcement doesn't love those, though.
They don't. But you can't overpopulate your jail with nonviolent offenders either. A person caught for shoplifting, a misdemeanor amount, and they don't qualify for a citation, then they're going to go to jail. So they're occupying, that's another space where you got a violent offender that needs that space. It just creates more burden on the corrections officers, more stress for the sheriff as well.
Right. And we got a related email from David. He says, how many inmates are in jail for mental health issues and how many are in for crimes? And I don't have that number.
I don't have the number, but I would tell you the overwhelming majority of inmates are in there with mental health issues. You may have heard the phrase before that the Duval County Jail is the largest mental health facility in the city, and it's true because they overpopulate the offenders.
And that's something that you are aware of and have
Yes.
looked into as well, Nichole?
Yes, that's another thing that is not just unique to Duval County. And I know that there have been counties who have tried to work around that. In Tarrant County, Texas, for instance, real quick, they have a center where if somebody is arrested on a nonviolent misdemeanor crime and they are going through withdrawal or they have mental health issues, they're actually taken to that center for treatment instead of the jail. And that's stuff like trespassing, very low level crimes, but that does divert some people away from the jail.
I know that's something that they've been discussing too as they plan for a new jail
Yes.
here in Jacksonville. So the sheriff, earlier this week addressed the idea of, people who are working for the facility who may have ill intent, like you said. He kind of obliquely referenced that idea. Let's hear a little bit of what he had to say.
If you want to come to JSO and your intent is to come here and do something illegal, don't, because we are going to find out. If you don't want to serve the people of this community, you want to serve yourself, go work someplace else. Go be an independent contractor somewhere else, but don't do it here.
Mark, I want to ask you because there are all kinds of drugs that can be manufactured in jail. And, recently there was this, well, not recently, I guess it was about 5 years ago, but there was this spate of people overdosing, some dying because they were smoking pesticides that were available to jail inmates through the commissary. Very addictive, very lethal, really.
Yeah, at K2 Spice out there, you have a lot of synthetic cannabinoids and cathinones that are being abused. A lot of them are being sold in these convenience stores. They change or alter the substance or the molecule of it so it doesn't fall under a statute, so they can't enforce it. That's happened. And those drugs, the K2 Spice, the synthetic cannabinoids and cathinones, are very prevalent within correctional facilities, not just JSO, but federally as well. Again, it's very easy to get it in. It can be in a liquid form. It can be in a small powder form. It's mind-altering. People can overdose on them. You got to remember something also in this, that these individuals, when they overdose, they can't tell you what they took. So you have a facility here. You got people that are medically okay, but they're going to treat you, but you don't know what they're treating them for. So sometimes, a lot of times with Narcan and substances like that you're going to administer, that may make the situation worse Fentanyl, xylazine, these drugs out here, a lot of it, Narcan's not working any longer.
We've got a call from Eric in Arlington. Go ahead, Eric.
Yeah, my son is down there right now. He's schizophrenic. He's in there for a nonviolent offense. He has no business mixing with some of the folks that are down there. You can turn him loose right now. For those that are listening, I was taking care of him before he got into trouble, but you want the problem taken care of. You got it. I don't know why you'd want it, other than this is just the Republican Party, which runs the state of Florida and has for a long time, war on poor people. That's all this is. They find people that can't defend themselves, can't afford a lawyer, mentally ill, and they pick on them until they end up in the jail down there, worse off than they were before. So if you want 2,999 people in there instead of 3,000, go ahead and turn my son out of it, and I'll come pick him up. Thanks. Bye.
Thanks, Eric. Well, obviously a really important conversation and a lot to discuss. I'm sure we'll revisit this in the weeks and months ahead. Mark Baughman, Nichole Manna, Ken Jefferson, thank you all so much for coming in today.
Our
Thank
pleasure.
you.
Welcome. Thank you for having us.